Each and every podcast of the Optimize You studio is sponsored by Optimize You Evansville. At Optimize You Evansville, we help you take control of your health, performance, and vitality through cutting-edge hormone optimization, peptide therapy, athletic recovery, weight loss, and sexual health solutions. Whether you're an athlete looking to maximize recovery, someone striving for sustainable weight loss, or just looking to feel like your best self again, we used advanced diagnostics and personalized treatment plans to get you there. Our science-backed approach helped optimize energy levels, mental clarity, muscle recovery, and overall well-being. Because feeling great isn't optional, it's essential. You ready to elevate your potential? Let's get started today at Optimize You Evansville, where normal is not optimal. It was, and just, I like to have the whole control, not control, but, like,
I get it.
hey, we want to do this, we want to do that, we want to do this, and I don't want to set up a date for 2 months out,
Right.
So we've worked together pretty much every day ever since. So we
In-house.
yeah, and we're gonna have it in house, and it's actually physically in my house now.
Oh, is it
It's
really?
It looks like industrial light and magic in my kid's old video game room. But yeah, so we're gonna do some really cool stuff, and to me, the things that set that marketing thing different is that we can all shoot things on our iPhone, and everybody thinks that's all magical now. There's lots of things you can do, but I just don't want that vibe. I want something that
Everyone can always tell the difference between real and, oh, that was on a phone.
Right, yeah.
It doesn't
Right,
matter how cool the phone is, if you can still tell when it was professional.
right. And whenever we would set those things up, and we had all of the gimbals and the tracking things and all that stuff where it would follow our face, and it just falls short. And there's a touch that if you can buy somebody, I use the phrase "bought in" a lot.
Mm-hmm.
When you have somebody that's bought into the art of it, this guy,
You win.
I win.
Yeah.
yeah,
I mean,
yeah. So
And I win too.
he wins. Yeah, he gets to do what he loves and make some scratch off of it, and go from there. And there's a beautiful harmony that comes along with that.
And I come from an educational background, so when I get to kind of help somebody also figure those things out.
I did too.
Right. Yeah.
My mom's a teacher, dad's a principal.
Yeah.
So I get it.
I got a
Right.
brain teacher, so
Yeah. So he kills it.
part of it for me too.
Yeah. So Dr. Matt Bertram, Doctor of Chiropractic Care,
There we
owner
go.
of Bertram Chiropractic and Wellness. Tell us all about yourself, man.
Started the practice February 5th of 24.
Okay.
Practiced a year before that. Made the leap into a lot more entrepreneur stuff, and had an opportunity over on South Green River Road where I'm at, and started. And here we are.
Right.
Went to Castle, graduated in 2016. Then went to USI, played soccer. Had a really bad head injury, and that kind of made soccer go away. And
wow,
that's how I
okay.
got into chiropractic.
Oh,
'Cause,
really? Okay.
yeah, I got kicked in the face, and in practice, the day after the first exhibition game, everything's going great, and then everything went black.
Yeah.
So, PT, OT, everything's great, but that didn't really get anything in my structure, and I started seeing a chiropractor, and that's when I really started getting everything going again.
Okay.
I really, everyone thinks I exaggerate. I couldn't read for 6 months.
Oh, wow.
I mean, in terms of comprehension and stuff like that. So, this form of healing really kind of gave me normal life back in a sense. So that's really how I got into it.
Where were you going before that? What was the life plan before that?
Something like everybody else, something medical.
Something medical.
Yeah. You know, everyone wants to go in the pre-med track, and then
Right.
you really find what you want. And then when I realized this is what I want to do, then that never really changed after that.
Okay.
So
Yeah. So the kicked in the head. Wow, that's
it was terrible.
That's terrible. That's terrible, especially in like a practice.
It
right?
was
Yeah.
practice.
Oh,
yeah.
jeez. So long-term concussion care, lots of PTOT.
PTOT for 6 months and 3 days a week.
Yeah.
And the biggest thing was the eyes. You know, you get rocked in the head. I mean, truth be told, I don't remember anything that happened that day besides it went black. And I said, well, here we go. You know, so that was not a good experience.
That's not. Yeah.
But you look back on it, it opened up a lot of doors for me elsewhere.
Sure.
So.
Sure.
In a way, I'm kind of thankful.
Yeah, we I have personal kind of a testimony to that as well. It's like bad things that happened at the time. Really, when you look back on it, you're like, oh wow, I wouldn't.
It shaped the future.
Right? Absolutely, absolutely. So, what in particular about the chiropractic care that you received after that injury?
Well,
kind of pointed you in that direction.
Chiropractic, it's so misinterpreted by the public, and the fact that well, I don't have neck pain, I don't have back pain, I don't have this, that, and the other. Okay, well, how's your structure? I see so many people whose structure is just terrible. Well, I don't have this type of pain, and my typical answer is, you don't have it yet.
Right,
So. It's basically getting my structure back right, and then allowing my body to heal after that. It was basically unlocking the doors for myself to get back right again. So that was the biggest thing with that. And then I have great admiration for all the therapists I used as well. So the chiropractic was just kind of the part that pushed me over the top, which I'm forever grateful for.
And so the track of education that you went through, you graduated from USI.
Mm-hmm. So I graduated from USI. I went there. I graduated in 3 years. Had 2 degrees, one in Spanish, one in biology.
Okay.
Then jumped into Logan University in St. Louis.
Okay.
2019.
Okay.
And then from then just started that journey. It was interesting. I went through school during COVID.
Right.
So everybody's GPAs are great. Not everybody's board scores are great, though.
Exactly.
I think our class set the record for the worst board scores in the school.
Oh wow!
But
okay.
I'm proud to say I never failed boards.
That did not include you. That's
no,
perfect.
the disclaimer there. So
Yep.
it was really interesting. We spent a lot of time during COVID learning how to adjust.
Yeah.
Because online school sucked.
Oh yeah.
So
I was I took my first stab at being a I don't know, adjunct faculty.
Mm-hmm.
Right before COVID started.
Oh,
so,
man.
I have a doctorate degree in nursing practice, but there's a lot of research that goes on, and I love the statistics in it.
Oh, yeah.
So I taught statistics at University of Evansville to nursing students, to a bunch of kind of healthcare administrative
minded
business people kind of people, and got the curriculum together, got all my PowerPoints together. Thought how I was going to do all this
is all going to be online.
And bang, now you have to figure out how to do this online.
Yep.
So I stuck with it for a few years, but yeah, it was tough. And I God bless the professors and instructors that lived through that and still going, because
100%.
it was difficult too.
So we went, it was my second trimester. We had a real early spring break because we did a year-round school.
Mm-hmm.
I think it was middle of March, I think, is when that, everything started happening. We went on spring break, and we did not go back until the next September.
Oh, wow.
Now we had like hybrid stuff and all that, but in terms of actual curriculum, it was a different story.
Yeah.
Because I wasn't used to online school. I mean, in college, maybe one online class,
Yeah.
and then you go from being in class attentive, this, that, and the other traditional school
Yeah.
to rocking everybody's world. And,
Well, in attending things like that, I mean, you're talking about 3 and 4 hour classes. It's not like you're
sitting at a
it's not
desk,
like a 50-minute class, right?
staring there.
Right, yeah.
Like, man, this stuff
Yeah,
sucks.
it's not your 50-minute English 101 class that you're sitting through.
No,
So,
and we're
yeah,
talking
that's a big
post-level
transition.
microbiology.
Right, yeah, right, exactly.
With a lot of words that I still can't even pronounce.
Yeah, right, exactly.
So
I've been in medicine for a long time, and with a really specific orthopedic concentration the past 14 years at this point. What and there's a lot of
There's a lot of overlap.
there. There's a lot of kind of disagreements amongst those two specialties or two disciplines, I guess I should say. As far as the education that kind of comes along with those 4 years of chiropractic school, yeah. What I mean, give us some insight on that, how that looks, because you're not. It is a medical discipline.
100%.
Yeah.
Well, I think you hit the nail on the head. I mean, I think we are so much more alike than we are different. I mean, we all learn the same stuff, but chiropractic is just based on what can I do outside, and physiologically, what can we change? Maybe it be 1 millimeter, 2 millimeters, I don't know, to prevent, serious invasive stuff. But I think at the end of the day, we're all working towards the same goal with that. But all the orthopedic tests, everything, stuff like that, range of motion, every curriculum piece, it's, from what I understand, it's pretty much the same stuff. So I think it's just a slightly different lens in the conservative versus whatever, for conservative versus medical versus this, that, the other, that, the quote disagreements happen on. But I think, I always pride myself on not really sounding like the crazy chiropractor. I'm not going to sit here, and like we talked about last week, I'm not going to sit here and tell you I'm going to fix all this, But if I can manage certain things and make it feel better longer term, who loses?
Right.
And to me, it doesn't matter who achieves that as long as we're patient-centered with that,
Yeah.
So that's kind of the way I view that, is I'd rather work together than have a pissing contest.
Certainly, yeah.
Who can do this better? Well, who cares if it's better as long as whatever it is working,
Right. We have a lot of patients that would come and see me through a walk-in or something like that. They would often ask, because there's things that we're orthopedic surgeons, right?
100%.
So it's the NSAIDs, it's the PT, it's the OT, it's the surgery, it's the injection, it's the, kind of these kind of couple of handfuls of treatment options that you can kind of look at. And then people would always ask us about, well, what about a chiropractor? I'm like, I don't know. What about a chiropractor? Like go try it out. I don't. If your insurance covers this, if this, that, and the other, then all better. So I never. My common answer to that was I don't pretend to know what it is that's going on there, but if it helps, it helps.
Well, and that's the same thing with me too. Right. If someone, do I need to go to ortho? Well, that's fine. Go get their opinion.
Right. Yeah.
Because we're gonna have overlap on that. Certainly. It's the way that it's treated. And guess what? If the injection worked better than this, great, go do it. Right, I don't care. This is not ego driven. Exactly. It's if you've had a broad-based disc bulge at L5 for 10 years and this is what's going to work, go do it.
Right.
I don't care if you leave here, but as long as there's some sort of positive result there.
Yeah. We do that with things that we offer here at Optimize is kind of like we do PRP. I know there's a lot of orthopedic groups that do kind of PRP. There's very famous podcast people that swear that it's the miracle and all these other things. So I was like, but there's a window of opportunity for everything.
100%.
And if you miss out on that window, well, then you probably have to to pick something else.
Pretty well gone forever at that point.
Right. Yeah. I'm not a fan of the PRP and stem cells completely curing the massive rotator cuff tear. That's not going to happen.
Thank you.
You know that. I know that. The people that know those things aren't good.
Yeah, but the problem is it's the people making the money off of it. Hey, this is going to cure every injury you've ever had.
Right. Yeah. Yeah. And I think there's a lot of people will ask. We're kind of watching a podcast before you came in here of some people that are in the same realm as us, and there's a reason why the talking heads of those fields aren't MDs or they're not DCs.
Hey, they're pretty good businessmen.
They're really good businessmen. Right? Yeah. So they have learned enough about it. They've probably brainwashed themselves enough about it to not be cognizant, aware, or even be ignorant of all the other things out there that you should do. Sometimes you just have to have surgery, Sometimes you just have to have those things.
Yeah, and I always tell people my biggest goal for stuff like that is to avoid surgery.
Right. Yeah.
But matter has limitations. If you break a bone bad enough, for instance, you need a freaking cast. Right. You need pins. You need this, that, and the other. I can't put that back together. Something's dislocated. That's a really big misconception too. If it's dislocated, guys, I can't touch it.
Right,
I mean, you're going to the ER. You know.
Yeah. Well, and and the thing about contrary to popular opinion, it's really the goal of orthopedic surgery, right? Too. You don't want to have to do surgery on a lot of these things, but sometimes you do. You know.
But and I tell people, if you're going to go see a surgeon, that's their job is to fix something with surgery, and that's not a knock on surgeons. That's just what they do.
That's just what they do.
If you come see me, what's going to happen? Well, you're probably going to get your neck adjusted. It is what it is, you know. So, and that's one thing. What do you think's going to happen? Well, let's take a guess here. You probably have surgery, you know, and that's fine as long as it helps.
Yeah.
You know.
To us, the perfect healthcare system would be where you don't go see the surgeon until surgery.
A synergistic system.
Yeah. You go see the chiropractor when the adjustment works,
correct,
or when the adjustment is necessary. You go, those kinds of things. You don't have, to me, conservative treatment over a 3 or 4 year period with an orthopedic surgeon is a waste of everybody's time.
Thank you.
100%. It's not necessarily what the surgeon wants to do. It's not, and it's not necessarily a good use of resources.
No.
And it's something that we should rely a little bit more on primary care,
on portal of entry type of providers.
Right. Yeah. Whenever there's a need for an orthopedic surgeon, it shouldn't be the job of the surgeon to determine that.
Correct.
That to me, the perfect healthcare system. And
it needs to be put on a platter. Right. Hey, we've tried this.
Right.
You're the last option. Take it.
Time to go here.
Yeah.
Right.
And at that point, you're having surgery or whatever else it is.
Exactly. You're going to, you're seeing a couple times, maybe giving a little bit of a extra conservative treatment, and then, it's time to do some things.
And that is what it is.
Yeah. So, I had never experienced chiropractic care until Wednesday of last week.
It was a good day.
It was a good day. Don't really, I've had injuries. I've had bad injuries. I've got, disabilities that linger on from that. But don't really have any pain along with it. Don't struggle with it. But whenever I came to see you, we talked about some things that and you and I can talk shop, so it makes sense. So
it's easier to talk to you about it, you know?
Yeah, it makes sense to me, and I can actually see what you're talking about on the x-rays and things like that. So kind of, and we'll have some video up along with this, kind of walk us through kind of do you want us to kind of comment as this goes along? Yeah. Okay. So I brought my buddy Dakota here with us. So we shot some pretty cool stuff. So we're going to walk through.
I've been excited to see this.
Kind of walk through what that day looked like, and you can kind of explain what a first time chiropractic visit kind of looks like.
Tell me when to stop.
All right, yeah, go ahead. Here's your beautiful accolades everywhere.
That's so great. That is cool.
So let's stop it right there for just a second. So I know that what makes you unique, and I just saw that word up there and just kind of cued me in.
Technique.
Is this technique called Gonstead, right?
Yep.
Okay. So explain that to the people a little bit.
Objectively, it's the most comprehensive system of chiropractic you can get. And it's based on 5 findings to come up to one conclusion. And when all 5 of those come up to the same things, we got a pretty good idea what we're doing. To me, I don't touch anybody without x-rays. Full spine, AP, lateral, and that's why I've got that new x-ray system where it's a full spine panel. One shot here, one shot there. I can see everything going on. Now, disclaimer: if you're pregnant or you're under 3 years old, then we're not taking X-rays. Right. That is what that is. I don't want.
Right.
But you just get so much valuable information. And whether that be unfortunately pathologies, anomalies, just stuff, congenital stuff. I can't tell you how many times I see in L6, and you have a transitional segment. I have no idea. Well, you've been to a chiropractor for how long, and you had no idea. So if they think they're adjusting L5, you're not even close to it. And I have an issue with that, because if you think you're on something, if I'm going to push on one of your bones, I want a pretty good idea what I'm doing here, So that's the biggest piece. That's the thing on the X-ray. What the initial visit is, the educational piece of it. My goal is to make enough sense to whoever the educational level of that client is, that they feel comfortable. And if we can do that, then we're going to get along pretty well, So that's the biggest piece is X-ray. Second, palpation, stiffness, swelling, tenderness. Those are the 3 things that I always, just tell people that we look for. anything that can just point to, hey, there's an area of irritation right there. Patient presentation is huge. If we're not on the same page, we're not going to get along. You got to communicate with me what's bothering you, because if I don't have any idea, now there's the intake form, all that. Right. But how many times is that totally comprehensive? Right, exactly. I mean, you've been in orthopedics for how long?
Yeah. Well, we look at intake. Every facet that I do in healthcare is based off an intake.
100%.
And we end up having the same conversation as soon as you sit down.
100%. Right? Yes. That postural assessment. I can't tell you how many times I watch people walk. The amount of gait abnormalities and what people don't realize, that can just signal so much. I always tell people, we'll see most of your postural stuff on the x-ray. Everything else we'll see with you. You're sitting right here, right. And then a piece that makes it very much different is the instrument that I use, and it's called a nervous scope. And it's so simple, but it gives so much information. I'm looking for subtle differences side to side. We've got two of everything. We got a lat here, we got a lat here, just for instance. And if I can find a subtle temperature difference coming out on one side of the spine, then that really can indicate to me, hey, we got inflammation here. All right, so we got a starting point here. Now I got 4 other objective findings of really good, accurate stuff that I can put together after we find the spot. Okay, now how do we correlate that to actually fix it? So as long as we're comprehensive and being accurate and both specific with what we're doing, I tell people all the time, I can pop any bone in your body. That doesn't mean it was done right, or it doesn't mean it was needed either. And if we're going to move something, I want to be very, very legitimate with it and confident to know that we're doing the right thing. Because as great as chiropractic is, you can also really screw people up, as we see in the news. Sometimes, unfortunately. But it is what it is. That's kind of in a nutshell what Gonstead is. It's just a comprehensive system of chiropractic.
Yeah. Well, so, and this isn't just me, kind of kissing your ass or whatever, but whenever we, Andy, our GM here, is a big fan of yours. She keeps talking. Oh, we need to talk to Matt. We need to talk to Matt. We need to talk to Matt. And throughout the community, well respected.
Yeah.
And everybody, the one thing that is kind of universal with everybody says, it's just different. It's a different approach. It feels different in there. And I know that this is one of the reasons why, which is kind of take this different approach to it. You can go ahead and roll there.
That's my favorite part of the clinic right there.
Yeah, it's nice. Okay. Speaking of that gait issue, there you go. Right.
You got drop foot?
I do, yeah.
When'd you have that?
It's from this.
Knee?
Yeah. All right. From the injury, not from the surgeries or anything like that, yeah. It'd be so easy. This is Dakota, he's my boy. So here we go with a X-ray mouth open, the old
AP open mouth.
That's right. So let's stop it right there, Dakota, because I'll make a little comment about this. So this machine, to do full body X-rays it
just doesn't happen.
It just doesn't happen, right? Yeah, you have to have incredible,
you have stitching software.
Or you have to, and it requires 3, 4, 5x the amount of exposure.
Typically 6.
Yeah, 6. So yeah, okay. So I knew it was a lot. So 6 times the exposure to be able to get the X-rays that you got in 2 shots. So that's
and there's an accuracy piece of that only people who understand what they're really looking at know.
Right.
Because stitching is great, but if you're standing 2 degrees off on the other shot, it throws your whole contour off.
Right.
And with this, I can see everything in one shot, and it's all connected. Yeah, the stitching looks connected, but it's not. It's just overlays.
Right.
So
very cool. So for people. Right. Yeah. Exactly. Just like on the camera.
Right.
Yeah.
100%. Yeah.
So we use stitching software in my ortho career. And it's shot here, shot here, shot here, shot here, shot here, shot here, shot here.
Oh,
you're relying on software.
Straight turn, straight turn, straight turn.
And you're relying on software to piece all that stuff together.
Right.
Whereas you can see on the screen here that how, that's a big, tall vertical panel. That's all big vertical panel that kind of gives everything on there. So,
right.
Yeah, you can go ahead and go.
Very pleased with how much more flexibility you can get
if we get this taken care of.
Okay.
So.
Sweet. I always do whenever I take like send pictures to my coach, and I've got a bunch of atrophy in this leg just from old injuries. I always to kind of feel like I need to do this right
You're
here.
leaning that
Yeah.
way, and I'll explain it in just a second. We can go back to the room.
Yeah.
All right, so two things matter here. If we're going to affect anything.
Okay.
So your foundation is number one, which is right here, which is obviously the pelvis there. So that's going to support your 24-story skyscraper.
The analysis, obviously, it's just a biomechanical analysis, but changing your foundation and your discs, that's what Gonstead is.
Yeah.
That's the two basically theories that was derived on is you can't change anything without changing those two things. And then as research and everything catches up, okay, that is true. Those are attached to literally everything in your spine. So,
Yeah. So here's a good visual of what that panel looks like. So, for people that worry about exposure to X-ray and all these other kinds, that's 2 shots right there.
well, and I always ask people, did you use a microwave today? Did you talk on the phone today? I mean, that's radiation.
Oh, yeah, sure,
Did you drive
right,
a
yeah.
car?
Yeah.
And having 2 shots, it's so minimal that, you would have to take 600 of those to have anything even remotely happen, and that would have to be at the same time. So,
Yeah.
This has nothing to do with chiropractic. Let's just talk physics. If you got a foundation problem, you got
Sure. Right.
that's just how that
Right.
works. So I've got to take care of the pelvis before we really focus.
It's not anything special about orthopedics or chiropractic. It's simple physics.
100%.
Right.
I mean, if you got a foundation issue, well, we got a problem.
Twisting forces, shearing forces, mechanical, everything that we're, a lot of times, orthopedics gets compared to like, kind of carpentry work. It is just
You guys
making
are
sure
bone
there's
carpenters.
much leverage is put on here. Into
You got a
here.
foundation
We
problem.
have to add more
you
screws
got-
to this end because
Right, yeah.
that's
That's how that works. So
same
I've got to
It's all
take care of the
about balancing
pelvis
weight,
before we really focus on anything else.
Okay.
So that's number one. Number two, if we're not taking care of your discs with everything we're doing, then I'm just wasting your time. 'Cause
Okay.
I can't change anything without affecting that because that's what the vertebrae sits on.
Okay,
So as you know. So let's pick this apart down here. Both hips I'm totally good with. You're 1 millimeter forward, 1 millimeter back. I mean, it's hard to get much better than that, to be honest with you. Now, the tailbone is what is turned more, and that's what's causing what we have here. I mean, we can see that's not straight.
Right.
Now, am I going to call it a scoliosis? Absolutely not. That's not even close to a scoliosis, but it's a compensation curve for what the tailbone's doing.
Okay.
So when we look here, center of the tailbone out, center out, we can see it's a little bit longer going to the left. So what that's going to do, center here, you're turned like this. That's fine, but when this turns, the L5 sits on that, that's going to turn with it.
Okay.
Well, then 4 is going to turn with it.
right.
Then 3, you see what I'm saying.
yeah.
At some point, it's going to go the other way, or else you would find yourself standing like that
Right.
constantly. Well,
Right.
you readjust yourself, that's why that's doing that.
All right.
So
yeah.
if we get this set forward, we'll take all the rotation out of this. Now, am I going to change it on the picture the way it looks? I don't know. I
Right.
don't really care as long as it's functioning better.
Exactly.
So,
That's a big
I've
misconception.
said that same line many times.
well, I mean, I'm just
Straighten my spine. You got to straighten my spine. Everyone wants progress X-rays. That's great, but don't get pissed off at me when it's not much different.
Yeah.
And my next follow-up is, do you feel better? Well, yeah. Then who cares?
Yeah,
You know?
and it's the same thing with ortho.
Yeah.
It's when people have arthroscopy or something like that. Those aren't really visual changes that you see on a plain film. Now you MRI everything, then that's everything's going to show.
Then we're
right?
getting into way different categories.
Right. Yeah. But things that show up on X-ray, unless you're putting a plate and screws or some sort of replacement, resurfacing, something like
Changing
that.
it's hard.
Changing is not going to show up. It's just not going to.
everyone wants to, I take a lot of progress.
But yeah, I didn't realize that's where I was going out here.
I was always so excited. I'm like,
We all give the same speeches all the time.
Dude, constantly.
Yes. Same scripts happen all the time.
Or for my purpose, not not the visual purpose there.
Right.
So, as we curve here, we're going to lean here, we're going to lean here. It is what it is. I'm going to work on those junctional spots with you.
Okay.
And I think, we'll just get that taken care of. I think the mobility and all that, you'll be solid from there.
That's it.
Left leg is 4 millimeters shorter.
Whenever we first started doing this podcast, when we were going through reels, I was like, "Gosh, I say okay a lot."
You learn a lot more about yourself.
And it's just like a glottal stop too. So like, hey, but like not that aggressive.
Okay,
Like
okay,
you're, yeah.
okay, okay,
So
okay,
funny.
okay, yeah,
More of a
okay.
finisher from the right leg right now. I think that probably has to do
Just an agreeable guy, you know.
as this turns, as we turn this back in, that will actually encourage that femur to drag up, because the way this is gonna affect the SI joint there. So if we can change the socket that that's sitting in, and we balance your legs out as much as they can, then we'll be in good shape there. Anything less than 7 though, I'm really okay with.
Okay.
So, your tailbone's fine here, I don't have any issue with that. L5, it is pinching, but you don't have much discomfort down there, so I really don't care. It's just what it is. I don't want this to get worse. We should have that space, that space, that space. You're pretty shallow there. That's a compensation for the 5th. We'll get everything taken care of. We'll be fine.
Okay.
Curve-wise, we're okay. We need a little bit more. That needs to be here, needs to be here, needs to be here. It's not too far off, so I'm not.
For as much as you lift, I was pretty surprised. I mean, your spine's solid.
Oh, good. Yeah.
I mean,
yeah,
it moves a little bit,
Yeah.
but not.
I'm truly blessed, fortunate, whatever you want to call it. Like I don't have much pain. I don't have much issue. Now I don't squat 400 pounds either, and I don't deadlift 505 or anything like that.
Good
Just
idea.
I'm a grease the groove kind of guy.
There you go.
There's no reason for that anymore.
I'm curious now what Derek Wallace is, because I know he does a lot of power.
Right. Oh yeah. Yeah. Those powerlifter guys are all compressed down, and yeah.
I'm really curious to see what.
Oh, I've got guys that power lift.
Yeah.
And their discs are like that.
Oh yeah. Yeah.
Guys, I can't change that. I mean,
Yeah. You just need to go hang somewhere.
We're
Yeah.
good all through here. One thing I do want to point out, we've got bone spur forming there, there, and there. They're small. I'm not going to get them to go away. I can keep it from getting worse. That's what I'm talking about. So,
you have a bone spur talk a lot.
Oh yeah, with bone spur talk all the time, and it's just because. And again, this is not a disparaging comment about anything, but somebody gets X-rays somewhere else before they come see us or before they come see somebody like you. That is really something that you can fixate on.
Oh, yeah.
It's something that I can visually show you. That's
Cosmetically.
spiky and pointy and looks like it's painful.
Yeah.
And it's probably nothing. Now, unless you got something in your calcaneus or something like that, then that's different.
Total different story.
But, bone spur, people come to us a lot of times also with the idea that we're going to remove that bone spur. And
If you want a lot more pain,
you want a lot more pain, you want some raw exposed bone there, then we can do that, where that's going to heal up and probably just come back.
because there's some sort of instability that causes your bones to make more bone.
Right, yeah. So, bone spurs are a difficult deprogramming thing. So are Baker cysts.
Behind the knee.
Baker cysts a lot of times are, there's a lot of deprogramming that goes along with that. Say, hey, okay, look, everybody's got these things wrong, And I always tell people too, if you bring an MRI, if you're 35 or older and you have an MRI of your knees and your shoulders, there's going to be something wrong with them.
100%. Well, that's why a lot of people ask me all the time, "Oh, you want to see my MRI? It's from a few years ago." I go, "No,
Yeah.
I'm going to take my own films." And to be honest with you, can I interpret the results of an MRI? Sure. Can I really read an MRI? No, that's what we have radiologists for.
Right. Yeah. And there's the technology is quote unquote so good now that it's going to find something wrong. You know, and
Well, that's what it's designed to do.
Yeah. Right. Yeah. That's what's causing your pain, and that's
70% of the time.
Yeah.
I would say no.
No. Yeah. Yeah. It's some fraying of this. Oh my gosh, we're going to clean that fraying up. Well, we can, but I mean, I don't know that that's really what your issue is.
Right.
So.
management mode, not fixed mode. So, neck should look like this. I'm glad there's no dislocations there.
Craziest X-ray of all time.
I'm like, that's
I've never seen
crazy.
that.
I had no idea.
Yeah.
I said, "You were in a car accident?" She goes, "No." I'm like,
Did you try to hang yourself?
"Shit." Well, did your husband?
Little context there. We're not making fun of people hanging themselves.
No,
It's
no,
like,
no.
he had an X-ray that was just
An asymptomatic dislocation.
asymptomatic at what
C3.
C3.
I'm like,
Which is-
you have trouble breathing? I mean,
which is-
that's your phrenic nerve.
Yeah,
It's C3, 4, and 5 is your diaphragm.
Right. Yeah.
And well, I mean, there's like a pars fracture in
Right,
your
yeah.
cervical spine. I'm like, I don't know. How do you function?
Vertebrae. It's like sitting like this.
Yeah.
Yeah, and
insane
I'm
looking.
like, can you feel your hands? She's like, well, they do go numb.
Oh my gosh.
I'm like, with all due respect,
That's the least of your worries.
we need to go somewhere else.
Yeah. My goodness.
Yeah, exactly. But like I said, your neck should look like this. I'm not going to make it look like that. I'm not going to sit here and lie to somebody and say I can't. I can make it more functional, then who cares?
Okay.
Posture-wise, we're talking skyscrapers, basements at the bottom, penthouses at the top. Your neck's a little
Use a
bit
lot of
behind the
analogies, too.
foundation.
Oh, yeah.
Everyone
Yeah.
carries tension and stress through there.
Yeah.
I think that's what it is.
It just makes it
Posture
easier. You know, it just
here.
makes it easier to understand.
Line should be going through dot. It's not. It's not. Cool. Any questions for me?
No, sir.
All right, let me run this meter up and down your back. Make sure this checks out. Again, I'm just checking your temperatures here. Wherever we're hot, that's really where we're going. Say about chiropractic, when it's done right, it's excellent.
Yeah.
When it's done wrong, though, I mean, you somebody up, you know, like, we're not taking a strap around your head and shit like that. You know, this is based on fucking objective stuff. Not just stiffness. You know what I mean? All right, here's how this works. I just want you to understand what I'm doing before I actually do it. Foundation's here. You know what I mean by that.
Part two.
The discs are here, as you know. Okay. These can't misalign simply because there's a joint there. That's got a gap first for that to open up. Okay. That that's the first step. And it's got to go backwards. That's the one thing physiologically, from my perspective, that I want you to take away from that. It's got to go back first. So knowing that the disc is attached to the bone, if the bone moves back, then the disc has two options. It's going to tear or it's going to go with it. Well, if it didn't tear, you'd know that.
Right, yeah,
So if the disc goes this way, there's our symptom of irritation. That's what's causing it. So twisting and whipping and turning your neck's not going to fix that disc whatsoever, or take any pressure off it. If anything, it's going to fuck it up worse. To be honest. So we've got to get under the vertebrae, lift, and just push it forward, which will take the pressure off the disc and take the pressure off the nerve. So when that misaligns, there's our pinch. We've got to lift it back over and have that even pressure. Gotcha. So sound good?
Yep.
How did you like the neck adjustment?
Cool.
I don't know if the dynamic of like being able to hear that is so. I mean,
It's definitely audible.
it's definitely audible. Yeah. Yeah. The doesn't hurt.
Well, the look on your face was great.
More
after
stunning
that.
than more like surprising than anything else.
so
Right? Yeah.
fast.
Right. Yeah. And the you know.
Cool. Perfect.
Yeah. Oh my God.
Welcome to chiropractic.
No.
Yeah. It's
That's the best part of the whole visit.
Yeah. So you know you I think I kind of felt it in my teeth a little bit, but the you know, other than just the apprehension about it, you know, it doesn't hurt. It's not scary by any means, but yeah, it's the idea of it. So yeah.
It is.
It's a little different feeling, isn't it?
It is.
But in all seriousness, and you'll see it
But
on the
on
video,
that, you see your head
feels like
barely
your head
moves.
just went
barely,
there.
barely
All
moves,
it did
yeah.
was right
Yeah,
there.
right, yeah.
So it's very, very controlled.
Subtle kind of
That's
thing,
why I got
yeah.
my hand there really to catch, so
Right.
we're not just
Yeah.
whipping your head in half. We're gonna go here,
Okay.
and then we'll go over there. If you don't mind.
Okay.
Yeah. You good? Mm-hmm. Perfect. Sweet. Perfect. And that's it.
Cool.
Like I said, you're healthy.
And I think important, and I think you do say it. You do say it here somewhere in the video, but we'll just reiterate it: is that you know it's not like you don't feel this, you know, like whenever you're doing all those things. So
That gives people comfort too.
Yeah.
I mean the amount of times I hear people, well, is this going to be like the movies? You're going to snap my neck? No. Is it going to make noise? You can attest to that. Now it's going to make some noise,
Make some noise. Yep.
but it's not. You know, we're not trying to give you a hangman's fracture.
Right.
you know.
Exactly. Yeah. Cool. So what does that
Look like taken care of.
Just get it adjusted.
Keep coming.
Yeah.
Okay.
Yeah,
All right.
I don't even think you need to be seen twice a week. I think
Okay.
you need to come once a week. for
Once a
while.
week? Okay.
And I don't. That's not forever.
Sure.
But enough until we get to where, all right, let's take a new X-ray.
Okay.
All right, we're solid. So
Cool.
biggest piece of that, as long as we keep clearing heat out of your spine, get that pressure off of that. I mean, heat literally means inflammation,
Okay,
or
right,
vice
sure.
versa.
Right, yeah.
So if we clear all that out, then we're really solid from there. So
Beautiful, man.
Sound good?
Thanks, brother.
Thanks for coming in,
Appreciate it, man.
I have to talk in a different language
Sure.
to a lot of people to just get them to understand it, and I can talk more freely with you.
Right, yeah.
All right,
That was the most enjoyable part of that was
Yeah, you just kind of talk.
there
shop
was
to each
no
other.
deer in headlights.
Right,
Look,
yeah.
you know, someone sees a tiny bit of curve in their spine, like, oh my God, what are we dealing with here? And you're like, yeah, we're good.
Yeah, it looks-
Yeah, I
looks
mean,
good
it is
to me.
what it is.
But so I come back to you tomorrow morning, 9:45.
Yeah, absolutely. It's going to be a good start to Monday.
So does the follow up is kind of the same?
Yeah.
Okay.
I don't deviate from what we find on that first visit. There's a lot of information that goes into that. And, if I bounce around, say I adjust your left elbow on the first time, well, let's try your right hip this time. Okay. What are we doing? Now we're guessing, and that gets away from every single thing I just tried to get accomplished was to not guess,
Right, yeah.
So no, we'll find what we find the first time. And for, several visits, we're going to work on those things.
Yeah.
And I tell people, I get asked, are you doing the same stuff all the time? Yeah.
Right. Yeah.
Did your problem change? Well, no. Well, then we're going to work on fixing that,
Right, yeah.
so.
Yeah, and it's that's valid with a lot of different things. So like for the best example I could throw you is so just because you have a problem with your left hip, it doesn't mean you have a
Doesn't
problem
mean
with
it's
your
your
right.
left, and it doesn't mean it's your left hip problem
yeah,
either.
yeah. But if we're treating your hip, doesn't mean we treat your right one too.
Correct.
So changing up things doesn't make sense from that standpoint.
You just hit the nail on the head too. The amount of people are like, well, you don't adjust one side.
Right.
Yeah.
That's where the problem
Yeah,
is at, right?
and that's I'm a big proponent of doing what you need because we're going to get a lot better results doing what you need a lot of times more than what you just want.
Yeah, well, we live in a culture where there's not a whole lot of patience when it comes to if people are hurting, that's one thing. There's not and we live in a society where if you need surgery tomorrow, you can probably get it. Even with insurance and things like that, even not non-urgent kinds of things. So the thought that, hey, I went, this is not better.
Plan B, Plan C,
right?
Plan D.
Yeah. What are we going to change? What are we going to do this time? Well, we haven't even given this a chance to do anything
Correct.
yet. We see that with hormone patients. We see that in ortho. We see that with the people that I talk to about training and nutrition. They're well, I only lost a pound over the past 10 days. Don't we need to change my diet up?
But how's your pants fitting? How's your shirt fitting?
Yeah. Don't. Hey, I'm not. I'm not seeing any growth in my shoulders. Do I need to change it? No. Just wait.
And that's one thing too about Optimize You and chiropractic is there's so much overlap with that in terms of the philosophy with it. You may feel fine, but I can get you to feel better.
Sure. Right. Yeah.
You may look good weight wise, but we can get you better. And then in terms of neurological stuff, clearing pressure out of the spine, mechanical stuff with that, how close to 100% can we get?
Yeah.
And as closer we get to that, that's what we're here for.
I told you this, but I'll tell everybody listening too, is that I told my coach that I was like, hey man, I'm going to go see a chiropractor for the first time. He's like, what do you mean?
For the first time.
I was like,
yeah.
I'm going to go see a chiropractor for the first, we're going to do the podcasting and we get kind of make these connections kind of stuff. And he was like, you've never been to Chiro before? And he's from Australia. So it's like, there's different terms for everything, physio and chiro and all these kinds of, I was like, yeah, no. He's like, no. If you want to be a bodybuilder, you go to every week, every week and make sure that everything is straight. And I was like, and again, it's that whole thing where you catch yourself, but I don't have any issue. Right.
Let's
keep it that
issues.
way. Keep it that way, so you can stay healthy and that kind of stuff. So,
there's an acute piece of it. There's a chronic piece of it, and then there's a wellness piece of it.
Yeah.
And all three of them can blend really well.
Exactly. Yeah. And you have the luxury in chiropractic care to provide all three of those.
100%.
Yeah. That's pretty cool. Because unfortunately, we don't get to do a whole lot of preventative care in orthopedics.
Right. Something bad has happened when they come to your office.
You're coming here because hopefully, not hopefully, but there's something that we need to do.
Tear
as
or
surgeons.
broken.
Right. Yeah. Yeah. Tear, broken, wore down kind of thing.
Yeah. So.
So chiropractic care, kind of like Optimize, is we get to practice this kind of this medicine 3.0 kind of thing, where it's
of getting your oil changed,
Right. Yeah.
and
yeah.
just making sure everything is where it needs to
before
be.
yeah, exactly. Yeah, that's a really good analogy. Get your oil changed before the engine breaks down. Just maintenance that that needs to be done.
Yep.
Yep. Very
100%.
cool. Very cool. So tell everybody out there how how do you get what other services do you offer? You have a whole slew of other
We
things
got
that you do
me.
there.
We got me, chiropractic, and we got 4 massage therapists.
Yeah.
And we run 2 massages on the hour every hour.
Yeah.
And keep it as simple as we can, and give people the services they want. Those are the main things. And we can. I do find myself giving a lot of people exercises and stuff like that, because I feel like that's well rounded.
Sure. Yeah.
What are you doing outside of the 5 minutes with me?
Right,
You
yeah.
know, but
Yeah. The home maintenance stuff
It's
too
very
is
important.
critical.
but that chiropractic and massage and some therapeutic stuff. Those are the main 3 things we do, and we just try to be as efficient as possible with it.
Yeah, I talked with a mutual friend of ours who is also a patient of yours and mine on Friday, and he's like, "You got to go get the massage beforehand. Here's the key: you get the massage first,
Yeah.
and then you get all loosened up. Then you let him crack on you, and then you just start your day off great.
Dude, it's like
I was I'll
butter.
have to give it a whirl. To give it a whirl. Yeah,
Yeah.
yeah,
Cold plunge massage.
Oh, yeah.
Chiropractic.
yeah, man.
That's a good morning wake up
That's
call.
right. Yeah, yeah. That sounds like the ideal way to start the week. Anyway,
Absolutely.
you start the day like that. That'd be great too. That'd be great too.
Yeah.
So, hometown boy, Matt Bertram, Bertram Chiropractic and Wellness, located South Green River Road,
111 South Green River Road, Suite H.
Suite H, yes, Brinker's Jewelers building,
Yep.
backside there. You have a website,
Yep.
you got some socials, you got all the good stuff.
BertramChiropractic.com.
Yep.
And then Facebook, Bertram Chiropractic. Well, Bertram Chiropractic and Wellness, yeah.
Okay.
But those are where you can find me. Phone number 812-464-4470. It's the office number.
Beautiful.
Anything you ever needs, if anybody ever needs anything, give me a holler and we'll get it taken care of.
And you're, you're not, you're a very busy guy. But
Yes.
You accommodate for a lot.
Still taking new patients.
Still taking
Still taking new
still taking
patients.
new patients. What's the future for Bertram Chiropractic look like?
Just try to remain
keep grinding for right
remain
now.
efficient, man.
Yeah, you're still, to
remain
have
efficient.
that many patients a year and some change into your practice is very well done.
Yeah,
sir.
last
Very well
week we did 84 massages, and I saw 604 people. So I slept good Friday night. I'll tell you that.
I will. I do. You think it's funny because we'll kind of text each other back and forth during the day, and and there's these large gaps. It's just busy. Yeah.
Oh,
you know,
yeah.
It's just these.
Well, the amount of text messages that I get that I'll respond and give me 5 minutes, get buried, and I end up second. I'm like, shit, guys, I'm sorry, I did not mean to blow you off.
I got
on
48
that.
people to respond to that I told was be 5
Yes,
minutes ago.
and that doesn't mean that you were low on my priority list.
yeah.
There's a little ADD
just
there,
going. Oh,
and then
yeah,
there's
sure.
a lot of pulling in about 5 different
Oh,
directions.
for sure. Oh, for sure. Totally.
I'm sure you can
totally.
resonate
So,
with that.
Dr. Bertram, thank you, sir, for coming to see us. I look forward to our ongoing treatments, and I'm going to keep everybody posted on how well we go. And more than welcome to come back anytime.
Absolutely.
Very soon we'll be closer to your house, so you can just come down and hang out in your loungewear, and we'll just
Probably
chill and
walk there.
shoot it.
So, awesome.
All right,
Well, thank you
man.
very much, man.
Take care, man. I appreciate you.
Yep.